Gavanas ma pacho ka koro dwaro mondo mi piny owacho ket omenda ma ichwalo ne sekta ma thieth e pacho ka. Ma oyangi e kinde romo mar riwruok mar Gavanas e boma ma Mombasa. Gavanas go koni pod nitiere rem maduong' e sekta ma thieth ma nyaka koro Bende gikwayo mondo mi orid chike mag okumba mag thieth ma SHA mondo mi kauntis oyud omenda mar thieth kochopo tarik 9 ma ok olewo.
Financing in counties. You realize, Your Excellencies, as a result of the withdrawal of USZ government, so many of the programs were actually cut short midway. What is it? What is the effect of the same in terms of running health function at the county? And what is it that you're supposed to do moving forward so that even the gains that have been for the last 12 years then are not lost as a result of this cut-off?
Of course, now we no longer have financing at a number of donors are pulling away. USAID, Danida is more or less on its goodbye stages, and we need to be able to now start thinking as a county team
on the issue of locking out our staff from SHA claims by 9th. We will not remit less money for SHA simply because the date passed. But for the time when they have not been able to get our remittance, our people will be locked out. It is as if we have a date with when we have to get sick. If there's a way we can tell our people don't get sick during this period, then that will be easy. But diseases are there all the time. So why this discrimination?